This is London. It's home to over 7 million people speaking more than 300 languages. It presents some unique challenges for health services. Let's now go and see how NHS in London could change to meet some of these challenges and improve the services it provides for Londoners. This is a building called a Polyclinic. Although it can be found in other capital cities, there are very few of these in London, so we have created it in the virtual world. Follow me inside and I will show you around. Many of the patients are here to see their general practitioners, so let's visit the GP clinic first. In this building, 3 GP practices work together, caring for a local population of around 50,000 people. They used to work in separate buildings, but being co-located together with a specialist consultants and the latest diagnostic facilities, they are able to work much more efficiently. For example, there is a pediatric clinic where children can be seen by GPs and, if the need arises, by their community consultant pediatricians, all in the same building. All of the GPs have immediate access to these specialists, and that means that mother and child do not have to travel to another location for specialist care. Patients tell us they find it difficult to get urgent and out-of-hour appointments with their community doctors, so they have to visit a hospital. As a result, Londoners make more visits to their accident emergency department than anywhere else in the country. Therefore, in this polyclinic, we have an urgent care centre that can be open up to 24 hours a day. Doctors can perform many simple medical procedures directly in these convenient treatment rooms. For example, this patient has just had a splinter removed from his hand. But what happens if you need an X-ray or a blood test? At the moment, you would need to go to a hospital. But in this polyclinic, we have the ability to perform most diagnostic tests right here. The radiology department is on the first floor. As well as X-rays, most polyclinics will have other diagnostic tests, such as ultrasound and in some cases CT scans. Today we can see Mrs. Robinson having an ultrasound of her abdomen because Dr. Count thinks she may have gallstones. And this test confirms it right away. After her ultrasound, Mrs. Robinson will see a surgeon next door who will help to decide the best treatment for her. She is saved an extra journey and she gets a diagnosis and treatment more rapidly. This diagram illustrates the number of visits typically required for this kind of treatment in the new system compared to what happens today. As you can see, we have many other specialist consultants working in the heart of the community. On this floor, patients can see orthopedic consultants or get help on issues of women's health. Let's go upstairs and see what else we can do. As well as consultants that specialize in all areas of general medicine, we will also bring non-medical specialists here. This polyclinic has a dentist where patients can get dental treatment on the NHS and also has an optician. But for a community polyclinic to truly serve its local population, it has to be able to reach out. So we have a base for the community nursing and the midwife teams who are able to visit patients in their homes. Nurse Watts is going into the community to see a patient with asthma. Community nurses such as this means that in many cases we are actually able to prevent some patients ever having to go to hospital for treatment. However, different populations have different needs. And what about patients who need admissions? Let's go and see a polyclinic co-located with a local hospital. This local hospital looks after a larger population of around 200,000 people. We are in the main reception area of the polyclinic building that forms part of this comprehensive medical campus. In polyclinics that are co-located with a local hospital, besides the urgent care centre, there is also a dedicated accident and emergency department. Upstairs, the radiology department is much larger. This building will run all the diagnostic tests for the whole of the hospital and also houses large MRI and CT scanners. On the top floor, you will see we are able to look after a wider range of conditions. For example, we have a hematology and an oncology clinic, where consultants from specialist hospitals are able to treat cancer patients at their local hospital. Our state-of-the-art blood testing machine automatically analyzes your blood on the premises, so that your doctor gets the results while you're still at the polyclinic. Finally, our community nursing team have a much larger building on the same site. The local hospital will also be able to look after patients in a way that is not currently possible in the community. It will have a dedicated day surgery and endoscopy unit. The campus also includes an inpatient admission ward, a medical admissions unit which can accept blue light ambulances. There is also a high dependency unit for patients who require more intensive observation, treatment and nursing care. It will also have a well-being centre where alternative therapies, pharmacists and health food shops can be found. The Healthy Living Centre will encourage the prevention of disease, and it will have a gym and a swimming pool to keep the local community healthy. I hope you enjoyed the tour of the Polyclinic and the local hospital. Remember, it can be found right here in the 3D virtual world of Second Life, so you are welcome to log in and visit this building at any time you like. We rely on your input to decide how healthcare in London will be delivered, so come and let us know what you think.